A lot of this meeting, we've really been focusing on, I think, a lot of the inner part of the socio-ecological model. Many of you have seen this model before. We placed the mother and baby, that dyad that's all important for breastfeeding, at the center of our model, and we look at what influences her. And a lot of the time that we've talked over the last couple of days, we really have been focused on who are those people that she interacts with, what's going on in her direct community, what happens in the hospital that she's working with, what happens when she needs to go back to work or back to school. We've really focused on how do we fix those systems. What I'm going to be talking about today is really going to the opposite end of that, out to the furthest reaches, to talk about what do we have in terms of federal policy in the United States that sets the context for how we can support women in this country. This has been an exciting few years. If you think about all of the things that have happened in the policy arena that are there to support breastfeeding in some way or other, it really has been an exciting ride that we've had in the last few years. I want to talk about 4 different kinds of policy. When we think about policy, what are we really saying? Some policies are just out there to set priorities. They don't do anything on their own, but they set out for us a game plan. They call people to a certain kind of action. So I'm going to highlight some of the priority setting policies that we've seen in the last few years. They mandate action. Sometimes they set out laws that we have to follow that change the way we support breastfeeding. Policy allocates funds. It gives us the money to do the things that we need to do. And policy allows us to do things that otherwise we might not have been allowed to do. So I'm going to give some examples of how some of the policies we've had in the last few years have focused on that. So first, on priority setting. When we think about health in this country, we set out a health plan every decade. We say, what is it that we want to achieve this decade? And for the last several decades, we've had goals of what we're going to do to increase rates of breastfeeding. But what's different this time around, why this policy is different, is we're no longer looking at this as just what do mothers and babies do. In the past, our objectives were about, did we get women to start breastfeeding? Did they continue? Were they exclusive about breastfeeding? And that's all we measured. But now, as we look forward to Healthy People 2020, we're saying that's not enough. We have to set goals for ourselves of how we're going to support women. We can only do that with a few indicators, but our indicators are about workplace accommodation, are about changing the maternity care environment, and making sure that we don't supplement babies early on. And so we're changing the way we're thinking about this to think more upstream policies, not just what happens with the individual mother and baby. Another key area of priority setting is the National Prevention Strategy. Called for by the Affordable Care Act, the Surgeon General brings together 20 different departments across the federal government and said, what do we need to do for prevention of disease? And breastfeeding was one of the key issues highlighted in that report. Mentioned a number of different settings and things that needed to happen there. Workplace accommodations talked about, peer support, lactation management, baby-friendly, campaigns for breastfeeding. All these are part of our national prevention strategy that multiple departments are signing on to their work on. We also have had priority setting related to the various policies on obesity. We know we have an obesity epidemic in this country, and there have been many reports coming out. A couple from the Institute of Medicine, the President's Task Force on Childhood Obesity, a bipartisan commission looking at what issues can we do from a policy standpoint that would be acceptable to both Democratic and Republican sides of the House. How do we move forward? And in every one of those documents on what should we be doing about obesity, they highlighted breastfeeding as a key activity. Again, we're setting it forward as a key priority in this country of how we address our most important health problems. The Surgeon General's call to action set forward a series of priorities on what specifically should we be doing about breastfeeding. 20 action steps focused on mothers and families, communities, healthcare, employment, research, the infrastructure, really thinking about that whole socio-ecological model and laying out a plan for us as a country. What do we need to be doing to make a difference on breastfeeding? It was key that it was a Surgeon General's call to action. It wasn't just a document coming out of one of the departments. It wasn't just a CDC or an NIH report. It was the highest public health official in this country calling us to action. And it was action to support. That little verb was not accidentally just thrown in there, well, we have to say something. We thought about promote, we thought about protect, we thought about encourage. It was very intentional that we wanted to focus attention on the support for women who want to breastfeed. We also have policies mandating action. The most important one that we're really trying to work through all of the implementation issues on right now is the Affordable Care Act. It mandated that all employers of hourly wage employees must provide breaks for nursing mothers and accommodations for them to express their milk at the workplace. That was a huge step forward. Prior to that, we only had a few states that were doing small things for subgroups of women. It was kind of a hit or miss approach. And through the Affordable Care Act, they said, no, this needs to be the policy across the entire nation. We're now in the mode of trying to figure out how to implement that policy. Department of Labor is very active in working with the states and with employers to make sure that they can follow that law. But in our latest survey, looking at human resource managers, do they provide accommodations in their workplaces? We saw the number go up from 25% to 30% after the law. We've got a long ways to go to get implementation of this in place. But the fact that we have a law to drive action is a huge step forward. The law called for coverage of women's preventive services with no copay. HHS came back then and said, how do we define women's preventive services? And they included support for lactation counseling and equipment for breastfeeding as part of those services. Again, we are in the implementation phase, trying to figure out exactly what that means. Who needs to be reimbursed? How do they get reimbursed? How many visits? How long of visits? For what women? All of those issues still have to be worked out, but the fact that we have a policy that says this needs to be covered by all third-party payers is a huge, huge step forward. Medicaid incentives. They didn't have quite the same language of saying that Medicaid has to cover these same services, but they did give incentives to the states. And rules for Medicaid are made on a state-by-state basis. And they gave them incentives so that they also would change their coverage rules to also cover lactation counseling and breast pumps. Another mandated action is the WIC Food Package, completely overhauled in 2010 to change the way we support breastfeeding. It changed when we offer complementary foods. It changed the incentive structure for women who are postpartum and are breastfeeding or postpartum and are not breastfeeding, to change that financial incentive that they actually had a reason to want to breastfeed financially. We also see policies about allocating funds. Many people don't even think about this as a policy arena, and yet if you think about it, it is our policy on how we spend your taxpayer dollars. So Congress sets forward various things that they think that we should be doing as a nation to support breastfeeding. One of those that I think is particularly exciting is the expansion of the maternal, infant, and early childhood home visiting program, the McVie program. That program was created by the Affordable Care Act with $2 billion spread out over 5 years. And in the last omnibus appropriations bill, it was up to $500,000 appropriated for home visiting. Huge program. Breastfeeding is part of that program, not necessarily a central part, but what the Maternal and Child Health Bureau has done is now part of their policy is to create collaboratives to try to change the program to incorporate breastfeeding in a much larger way than it ever has been in the past. The WIC peer counseling program. We changed a few years ago to go from a very small peer counseling program and expanded it to $15 million and expanded it now to $60 million and continues that program. It has been threatened numerous times and yet continues to survive. It's exciting for us to have $60 million going out to support women in the WIC program with peer counseling. Up until this last year, the only place in the federal budget that you would see any allocation that said the word breastfeeding in it was the peer counseling program. In this year, we now have a program called Hospitals Supporting Breastfeeding. It's a relatively small program at $8 million, and yet it is dedicated funding for breastfeeding itself. I find it very exciting, particularly since it goes into our own budget, but I find it very exciting that we have budget directed to breastfeeding. Then you have policies not necessarily at the legal level that it has to be spent in a certain way, but within our agencies, we make policy decisions about how we're going to spend the money that is allocated to us. So the Maternal and Child Health Block Grant Program now has performance indicators in it about breastfeeding measures. So when states receive funds from Congress, they now have to say how they are going to actually achieve better outcomes in breastfeeding. How they spend the money is up to them, but if that's what you're going to be held accountable for, changing those outcomes, it certainly changes the way you spend your money. Healthy Start is going out with a new set of grants this year and emphasizing the importance of breastfeeding within Healthy Start agreements. The CDC State Public Health Action includes diabetes, heart disease, nutrition, physical activity, and obesity. And it was a CDC decision within that to mandate that all states receiving enhanced funding, which is now 32 states, must be working on breastfeeding as part of their programs. Of those 32 states that are receiving that funding, 21 of them are working on maternity care practices, 17 are working on workplace accommodations, and 7 are working on community support, peer and professional support in communities. That's a CDC decision, but it's a policy made at CDC and therefore will stand the test of the 5 years for that cooperative agreement. The WIC program makes internal decisions about its own budget, about how it will spend administrative funds, and is now working on the Loving Support campaign and trying to revitalize the campaign that's been around to make it a new campaign available to us and pertinent for women in 2014. In terms of allowances, what does law allow us to do? What policies do we have for that? Well, as you go state by state, we now have laws in 49 of the 50 states that protect women's right to breastfeed in public. The IRS changed its rules about how can you count tax exemptions. Do breast pumps or other medical equipment for breastfeeding count as part of your tax benefits for the IRS? And they changed their rules a couple of years ago to allow those coverage. The TSA didn't used to allow women to carry their breast milk on the plane, and now allows that. So these are smaller policies, but little by little, each department is seeing how they, too, can help support breastfeeding. So I want to close just thinking about, so what else is on the horizon? These are the exciting things that I think we've seen over the last few years in terms of changes in policy. But what's on the horizon for us? The Affordable Care Act covered nursing breaks for women, but only for women who were hourly wage. There are many women who are exempt from that because they're salaried or exempted, such as teachers. The Support for Working Mothers Act extends that benefit to all working women. We need to see that pass so that we don't have women falling between the cracks. There's a lot of work going on now on paid family leave, some at the national level, some at the state level. It's come up many times in this conference about how important such a policy would be, that we need that kind of protection like most other countries around the globe have. I think the leading force in this is really not the breastfeeding community. It really is the child development community and the women's rights community. We need to be collaborating with them, partnering with them, to ensure that this kind of support for nursing is extended to all women across the country. Medicaid coverage. As I said, the Affordable Care Act did not mandate that Medicaid cover lactation services. It is a state-by-state decision. And that means we need to be working on a state-by-state basis to define how is Medicaid going to cover lactation services. It does provide services in some states under certain circumstances for certain women. We need to continue to work on a state-by-state basis to expand that coverage. New payment models. The Affordable Care Act opened up new opportunities for us to think about how we pay for health care in a very different way. We haven't overhauled it all in just a few years, but there are so many experiments out there, innovations, looking at how we can do this differently. An example is third-party payers who are now paying for a Y membership. So that rather than just a physician counseling someone, you really ought to get more physical activity, the third-party payer will actually pay for you to go to a gym. Can we look at the same kinds of models for breastfeeding? Do we need to have all of our support for breastfeeding be in the healthcare system, or should we be paying for things like setting up support groups, mother-to-mother support? Should we be working more with the community health workers and peer counselors as part of our healthcare system, maybe not on the same kind of payment directly on a fee-for-service type basis, but build it into the way we pay for healthcare as a country so that we really are thinking about preventive models, not just treatment models. What else is on the horizon? California just passed a law that all hospitals in the state of California will have to become baby-friendly or pass some equivalent designation process. Are we going to see that same kind of thing in other states? What does equivalent mean? This is a process that is going to be changing over the next several years as we look at policies on a state-by-state basis and perhaps on a national basis to actually incentivize in various ways the changes in maternity care that we need to see. Another kind of incentive that's been talked about in a number of states has been pay for performance for baby-friendly hospitals. Is that a new direction for policy? That perhaps Medicaid would pay a higher reimbursement rate for a hospital that has been designated than for a hospital that has not been designated? It's a direction that policymakers are talking about. I can't say on any of these, are they going to pass in the next year? But these are the kinds of conversations that people are having, and that this kind of a group needs to talk about the pros and cons and come to some kind of consensus on what we want to push forward. Changes to the WIC Food Package. I talked about how the changes in 2010 were dramatic for increasing the incentives for breastfeeding. WIC is now going to begin the process for changing that food package yet again. The rules say that the package should be changed every 10 years, and the process last time started in 2003. So we're now in 2014. It's time for that process to begin. WIC is going to be doing scientific studies, looking at what needs to change for that package to be more supportive of mothers and babies. And part of that being supportive of mothers and babies is being supportive of breastfeeding for those mothers and babies. So we need to be paying attention to that policy discussion and encourage those kinds of policy changes to move forward. So I hope this little bit of an overview of what has gone on in the past, how exciting I think all of that has been, as well as what I think are some of the exciting opportunities for the future, give you some food for thought and directions for us to move into for another exciting decade ahead of us. Thank you for your attention.